PMT Partners is pleased to announce the immediate availability of the Oxylator EMX and Oxylator HD compressed gas powered resuscitation units. These are devices that can serve a variety of roles in both hospital and pre-hospital settings. They can serve for acute resuscitation or ongoing ventilatory support in the event of a surge capacity ventilation occurrence. These devices have helped thousands of patients during resuscitation and short-term ventilation in the United States as well as Europe and Asia, and have served in theaters of war as recently as the last 10 years. For more information, please contact a representative. This is Dr. Jim Ducanto. Hi, it's Dr. Jim Ducanto. I'm from Milwaukee, Wisconsin. I'm an anesthesiologist. I'm here to talk to you about the Oxylator, EMX in this case. We're going to be talking about a device that is intended to work in the same capacity as a bag valve device. However, this can provide continuous ventilation to a patient. It's descended from a device known as a demand valve, which is a push-button ventilation device, but the limitations of this device have been removed in the Oxylator. First things first, its peak airway pressure is set by a dial from 20 to 45 centimeters of water, whereas the demand valve has a peak airway pressure capable of 60 centimeters of water. Obvious limitations with that. The Oxylator can be used to continuously ventilate an intubated patient. I'm going to set the device to 32 centimeters of water. It should deliver about 500 milliliters tidal volume to our patient here. Take it down a little bit to 30 centimeters of water. And now we have approximately 510 520 cc's per tidal volume breath. The Oxylator is made for the purpose of delivering a minute ventilation between 10 and 12 liters per minute. That can be downregulated if we run the Oxylator off of a flow meter and reduce its inspiratory flow from 30 liters a minute down towards 25, 20, or even 15 liters per minute. With the molded 22 millimeter connector, we have the ability to mount an extra HEPA filter to filter the exhalatory gas. This is one HEPA filter. Here's a second one. We can double up on the HEPA filter. And in addition to that, we can mount a PEEP valve. Let's go ahead and mount that on there. I'm going to have to turn down the pressure release a little bit to reduce the tidal volume because we're holding an extra 10 centimeters of water PEEP on. Here we're about 27 centimeters of water pressure release. The Oxylator is available for the purpose of both face mask and supraglottic airway ventilation as well as tracheal tube ventilation. It can be used as both a transport ventilator and potentially in a mass casualty surge capacity ventilation scenario, it can serve as a ventilator. Although it is actually classified by the FDA as a resuscitator just as the bag valve device is. Thanks.